All right, so my name's John Berliner. I'm one of the hip and knee specialists at ONS, and my practice focuses primarily on hip and knee arthritis and hip and knee replacement surgery. The talk that I'll be giving today is focusing on modern trends in total hip replacement, specifically rapid recovery and transitioning into outpatient hip replacement surgery. So just to start with the very basics, reviewing what arthritis is. Arthritis in its most simplest form is loss of articular cartilage. So the cartilage is a protective layer on the surface of the bone that allows for smooth gliding in the joint as well as pain-free motion. And when that cartilage thins out or goes missing, that's what arthritis is. And now there are multiple different reasons that arthritis can occur, everything from wear and tear to an inflammatory condition or prior trauma in the joint. But regardless of the reason for the arthritis, they all result in pain, limited range of motion, and decreased function of the joint. And I think it's important for patients who are experiencing the symptoms of arthritis to recognize that it's an extremely common issue in this country and that it's projected that of the portion of our population that are baby boomers, about 40% or more will be dealing with the symptoms of arthritis as they age. So this is an extremely common condition. Because of that, the projections of the demand for hip and knee replacement are exponentially increasing. And this study demonstrated that over a 25-year period, the demand for knee replacement would increase by almost 700%, and the demand for hip replacement would increase by almost 200%. Now, when we talk about the treatments for hip arthritis, we generally break this into two broad categories, the non-surgical and the surgical management of hip arthritis. We almost always start with non-surgical treatments with the goal of reducing the inflammation in the joint, hopefully minimizing the patient's pain and allowing them to get back to the activities that they typically like to do. The mainstay of non-surgical treatments are anti-inflammatory medications, and these come in both over-the-counter and prescription forms. They generally work quite well. We also generally advise the patient to minimize their high-impact activities and stick to activities that don't seem to irritate the joint. Many patients will try physical therapy, injections such as intra-articular cortisone. Weight loss can be an extremely effective treatment, as well as sometimes, if necessary, assisted devices such as a cane just to get some of the weight off the joint. I think for patients that have tried and failed these non-surgical treatments, surgical management of the joint certainly becomes an option, and in the case of hip arthritis, it is an extremely effective way to essentially eliminate the arthritis from the joint and hopefully eliminate pain as well. So many patients come into the office asking who is a candidate for hip replacement surgery, and I think a lot of factors go into making this decision. We always listen to the patient's history, how long they've been dealing with their hip pain. We do a thorough exam to confirm that their source of pain is coming from the hip joint, and we always look at x-rays, which are very effective at identifying arthritis within the hip. Almost all patients have tried and failed these conservative treatment options that we just reviewed, and this has resulted in real functional limitations so that they're not able to do the activities that they typically like to do, and therefore feel that their quality of life has really started to decrease. But at the end of the day, this is really an elective operation, and timing can largely be a personal decision, meaning each patient may be different in terms of when they feel their pain has progressed to the point where it would warrant surgery. But when that time comes, it can be a very effective treatment. So now transitioning into rapid recovery after total hip replacement, we'll go a little bit into specific techniques that we've used over the last several years to maximize patient recovery, minimize pain after the operation, and get patients back to doing all the activities that they'd like to do as quick as possible. We'll talk about techniques for both before, during, and after surgery. Before surgery, I think probably the most important component is just educating the patient, talking about all the expectations after the surgery, the specific things that they'll be required to do in terms of the recovery, and I think this takes away a lot of the apprehensions of going into the operation and also maximizes their recovery and speeds up their recovery. Our practice will always provide a case manager who helps arrange their post-surgical care as well as the physical therapy, and that case manager and the physician will always give the patient thorough education and instructions about what to expect after the operation, as well as how they'll best recover at home. We'll also give patients a preoperative manual that's very specific and thorough and really goes through every facet of the recovery. Physical therapy also will typically evaluate the patient and work with them before the surgery. They'll review their postoperative home physical therapy and requirements. They'll teach them to use a cane and a walker if necessary, and how to navigate their home if there's any tricky parts of getting around the house, such as stairs. And they'll also teach them how to do their essential daily activities, such as getting in and out of the bathroom, getting in and out of bed, and getting around the house. And this way, before they even start the surgery, they feel confident and comfortable that after the operation, they'll be able to navigate their home and do the basic functions that they need to do. During the operation, we've certainly made a fair number of changes to minimize trauma during the operation, as well as speed up patients' recovery. So I've been doing this direct anterior approach, which is a specific approach for total hip replacement that spares the muscles and tendons, so it's a true intermuscular approach. Another nice thing about this is because we're not cutting into the muscles or tendons, we're not waiting for any of them to heal after the surgery, and therefore there are no restrictions after the operation. And there have been many studies on this specific technique, and most of them show that patients will have a quicker recovery and less pain medications are required after the operation. One of the most important changes that we've made also is the anesthetic techniques that we're using. And this is multiple different factors that we do to minimize pain after the operation. Instead of using high doses of narcotics, which were traditionally used over the last 5 to 10 years, we've really tried to minimize the amount of narcotics that patients are getting, and instead give them multiple medications at much smaller doses, and really minimize the amount of narcotics that can come with many unwanted side effects after the surgery. Regional anesthesia comes in the form of nerve blocks, where the anesthesiologist will inject a local anesthetic around the specific nerves that innervate the joint. And this can often be a very effective way to minimize pain after the surgery for the first 24 hours or so. We're using shorter acting spinal anesthetics. That way, after the operation, almost immediately when the patient gets to the recovery room, they're able to get up and start walking and doing their physical therapy, with the goal of having them go home as quick as they can. And additionally, we're doing what are called intraoperative periarticular injections, where we do almost 100 very small injections of a local anesthetic into the joint during the time of the surgery, as an additional way to minimize pain postoperatively. Our wound closures these days typically do not use staples or stitches. We often use a glue on the skin, which is waterproof. We also apply a waterproof bandage, and this way the patients are able to go home and shower immediately and really have no restrictions at all after the operation. So now we'll discuss a little bit about outpatient joint replacement surgery, specifically where patients are able to go home the day of the operation. And many patients or practitioners would ask why. Why would we be transitioning to allowing the patients to go home the same day of the surgery? And I think it's really a natural progression of these rapid recovery protocols and different techniques that we've implemented. And there are many benefits to the patient. And I think for almost all patients that have been able to go home the same day of the surgery, they really appreciate being able to do that in the comfort of their own home. So I think sleeping can certainly be easier. You're not in a hospital, which can be busy, where the beds are quite uncomfortable. You don't need to ask for your medications. You don't have to ask a nurse to help you out. These are readily available, at the bedside. You don't have to have your blood drawn in the morning. You don't have to ask to get out of bed. You can freely move around your house. Many studies have actually shown that there's a small reduction in the infection risk if you're able to go home and not stay in a hospital. And I think in our current environment, obviously there are benefits of not having the exposure to the hospital and being able to go home immediately after the operation. So I think obviously one of the most important components of this is patient selection. Many patients may come in and be interested in going home the same day of the operation, and to be honest, the vast majority of them are certainly candidates to do this. I think one of the most important things is that patients are motivated, meaning they just want to go home the day of the surgery. They're excited by the idea of not staying in a hospital, and they're excited about the idea of going home immediately after the surgery. Typically, patients are generally healthy. They don't have any significant medical issues. And generally, they're not overweight in the sense that they would have issues with sleep apnea or potentially airway and breathing after the operation. Also importantly, patients need to have a caregiver, meaning somebody that can drive them to the surgery, drive them home the day of the operation, and probably help them out just a little bit at home the first day or two. Not that patients are not independent, but just with little things around the house and keeping an eye on them the first couple days. Post-operatively, after the surgery, if a patient does go home, we certainly have a lot of lines of communication with the patient to make sure that they're doing well and they're feeling comfortable at home. Our practice will check in with the patient the first, second, and third day after the surgery to make sure that they're feeling okay. Patient's pain will certainly be controlled. You know, they're getting the same medications they would get in the hospital at home, so there's really no difference there. We also set up a physical therapist to see you the day you get home from the surgery, as well as typically each day during the first week and about 3 times during the second week. And we're also able to arrange, if necessary, a nurse to come to the house just to help out with any other loose odds and ends. So there have been many studies now looking at the rates of complications or adverse events after hip replacement when comparing it to doing it in a hospital versus going home the same day of the surgery. And really none of these studies have shown that there are increased rates of complications or issues after the operation. And there also have been a number of studies now looking at patient-reported outcomes and patient satisfaction after outpatient joint replacement surgery. And the majority of these studies do demonstrate that patients actually prefer going home the day of the operation, and that the patient-reported outcomes are equivalent or even in favor of outpatient surgery. So I think just to summarize the take-home points here, overall, total hip replacement is an extremely successful operation with very reliable and good outcomes. It is important to talk to your surgeon about what post-operative recovery plan may be best for you. But I think at the end of the day, outpatient total hip replacement is a safe alternative for healthy and motivated patients with equal or even lower risk and improved patient satisfaction. So thank you very much for your time.